Hey TikTok, what's up? What's up? What's up, family? Um, Excuse, I know there's a glare. I'm sitting outside my house right now. Um, hold on. Hey, let me try to get myself away from all that sunlight. I don't know if it's gonna work, but hold on. Yeah, let me sit back. I needed to get outside and I needed to catch some air because, I just got off from work. Yes, I'm in my moo. Okay, I don't care nothing about that right now. I got something I want to talk to y'all about. So last night, I had 4 codes in a row. Alright, 4 of them. 4 in a row. So they were rapid response into code blue. They were all CBA patients. Rule out stroke. All right, that's what that means. Rule out stroke. So CBA is code for stroke in the medical world. Y'all already know that. Okay, if you didn't, now you know. So what I want to talk about is the first one, because the first one was my actual first code in the hospital. Okay, and when I tell you my nerves are shot, when I tell you all I can do is just breathe right now. So it was a busy night. I had 2 admits off top. All right, off top at the start of the shit. And so it put me behind because coming on, I had to, go do the whole spew with 2 new people. All right, cool. Nothing wrong about that. I'll just play catch up when I get done. So that I was doing. I went into 2 rooms. I went into about 3 rooms actually. And I was catching up on vitals, making sure they were done, because normally we start vitals around 8 o'clock at night. Okay, so it's rolls around about 10:45 rolls around. I should be about halfway done, but I'm not because I had those 2 admits at the start of my shift. So what ends up happening is I was gonna go into a 4th room to get another set of vitals, but then something told me don't do that. Some said go check on your new admit because they are actually probably the most unstable. All right, let's be real. My charge went in there and saw him, and the wife was bedside. Went in there and saw him and the wife. She said he's cool, go ahead, do a few sets of vitals first and then you can come in and see him. He's cool. I already went and seen him. He walking around, he's talking. I told him, we not going to walk around. We going to have to get in this bed. We going to be fall precautions. That's what the charge said. We going to be on fall precautions. So we're just going to be as standby as this. Just in case, okay? We don't want nothing to happen. Just in case. He was like, all right, cool. So he lay down in the bed. Mind you, he's about 45, okay? 45-year-old male. 45-year-old Hispanic male, okay? I'm saying that for a reason, all right? Just hang on, okay? So the nurse was already in the room. And so I go in there, I got the bucket, I got everything we need to go ahead and start these assessments and everything. She's already doing some of the assessment when I come in, and asking the questions and things. He's answering them, his name, his date of birth. He's answering them all right. Where does he live? How old is he? He's answering everything correctly. The physical assessment, we got about halfway through it, not even halfway through it. And things just start going downhill. So I go to get the vitals. I put the cuff around his arm, and he just jerks his head, just kind of like a jerking motion. And I'm like, are you in pain? Are you okay? What just happened? He's like, yeah, my head hurt. Head hurts real bad. And I'm like, okay. I look at my nurse. My nurse looks at me. Go get the charge. Went and grabbed the charge nurse. And the charge nurse is like, all right, what happened? What's going on? Can we get she starts asking him, the normal questions and everything. Do you know where you are? What's your name? What's your date of birth? How old are you? His wife is bedside. Do you know who that is? They did they did the pupil check and all that. He's reactive. Blood pressure it went sky high, okay? It went 192 over 123. Astronomical fucking numbers, okay? So, you know what? I knew something was wrong because the first set of vitals I got were low. They was like in the 153, not super low, but unusual low for a rule out stroke. Should have been a little elevated. Like 153, that's not elevated enough. So I went to the other side, the other arm, got those vitals, and then it was like 173 over like 82. We're like, okay, yeah, that's better. That makes more sense, right? So during the code, the vitals shot up to like 192 over 123. That's astronomical. Like, excuse me, sir. What the hell? What the hell happened? What is going on? So we're asking him the questions and everything. Charge is asking him the questions and everything. Asking him, can he hold his arms up? Can he hold his legs up? Can do it. What's your name? I don't know. Eyes rolled back. Doesn't know where he is. All drowsy. Charge is like, you know what? Just go ahead and call it. We call it. Everybody's in the room. The wife, she's crying, as she should. We ask her to step out. We start running the code, So what bothered me, why I want to have this talk with y'all is, what bothered me is, come to find out, we got him back. All right. We got him back. He's stable. All right. This is what bothered me the most. If your wife asks you or tell you, baby, we need to go to the hospital, listen to her. Your spouse, your husband, your wife, it don't matter which one. If they say, baby, I know something's off with you, you should go to the hospital, you better listen. This man waited he waited 7 fucking days. All right, because I'm mad. Okay, he waited 7 days. He had symptoms of a stroke for 7 fucking days. All right. The wife noticed something was wrong on day 2. No, he told her, I'll just keep taking Tylenol. That's what she said. That's what he said to her. I'll just keep taking Tylenol. I'm fine. Day 7, at the very last moment, she got him up there right in the nick of time, okay? Had she not convinced his ass to come up here, to go up there to the hospital, who knows what would have happened. Listen to your spouse if they say, take your ass to the fucking hospital. Okay? PSA, take your ass to the hospital. All right. Bye, y'all. I need to decompress.